Welcome to Trauma-Informed Care, which is part of the Pathways Transition Video Brief series. In this video segment, Dr. Julie Rosenzweig, a nationally recognized expert on the effects of trauma on youth development, talks about how to create a safe space for working with young people who have been affected by trauma. Dr. Rosenzweig focuses on applying principles of trauma-informed care.
So trauma-informed care is a concept or a construct that's, kind of been kicked around now for about 10 years or so. And it really talks about having an understanding. It's a framework. It's not a set of skills or tools necessarily, but it's really having an understanding that, number one, experiences of trauma are very pervasive in the general population, but almost 100% of people that come in to receive services, whether it's in the mental health system, social service system, criminal justice, juvenile justice system, high percentages of individuals are in those systems because of trauma experiences that they have tried to cope with, and the coping has been unsuccessful. Service systems are largely designed for circumstances that have gotten out of control. So they very rarely address the traumatic experiences that an individual has experienced. There's an African proverb that really captures that, and it says, "Do not look where you fell, but where you slipped." So really what that means is, let's take a look at what the trauma experiences are and how they've informed your ways of coping. And many service systems now are taking a trauma-informed approach, which means we accept the fact that trauma is very pervasive, first and foremost, and that we need to inform our practices, our policies, our protocol, just the very way we do business with that first and foremost in mind. Part of trauma-informed approach is also practicing what's called a universal precaution, which a lot of people understand from a public health perspective. But what that really means is, let's assume that everyone walks through our door that is receiving services or is mandated to services has a trauma experience, and that we have to do our very best to reduce further traumatization and re-traumatization. So what is re-traumatization? It's when things in the environment, perhaps the physical environment, the way we interact with people, the way we respond to people, will activate their trauma. So if you understand that people that walk through your door are going to scan for threat and danger in the environment, then we want to do our very best to have it be a safe and welcoming environment. That's first and foremost. So safety is at the top of the list when it comes to trauma-informed care. Things have to be safe. We also have to be trustworthy. We have to collaborate with our youth. We have to empower them. We have to give them choices. So there's certain principles of trauma-informed care that need to permeate the entire culture of an organization, and each and every provider and staff member needs to understand that, so that really we try to minimize any threat that is perceived in the environment. And I'd like to spend a little bit of time talking about safety, because we hear that word a lot, and we understand it from a physical standpoint, and we somewhat understand it from an emotional standpoint. But why is safety so important? Well, neurobiologically, if we don't feel safe, if our brain doesn't think an environment's safe or a relationship is safe, it's going to stay on high alert. And when it's on high alert and scanning for threat, it's basically driving all the resources to manage anything that might come into the environment. So the brain is really this wonderful resource distribution center. So if things aren't safe, all the resources are going to go to the center of the brain, the amygdala, the hippocampus, to understand where the threat is and try to manage it. That means that some of our other higher cortical processes in the brain, such as our thinking processes, our decision-making processes, really aren't going to be as strong. The resources aren't going to go there. So without safety, there's not going to be emotional regulation. Without emotional regulation, there's not going to be cognitive processing. If we can't feel emotionally regulated and use our thinking centers, then we can't really make meaning of our lives. We can't explore both out in the world and internally to really kind of move ahead in terms of who we know ourselves to be. And we really aren't going to understand ourselves in or outside of relationships or in the larger world, which is pretty fundamental to what adulthood is. So if you kind of wrap this all together and you say, well, how do we understand neurobiology of the brain just kind of during these very rich developmental years? We understand neurobiology of traumatic stress, and we put it all together. We need to package our services to really understand youth in a way that allows them to tell us about their lives.
Discussion questions and resources on trauma-informed care can be found through the link listed on this slide. A live link can be found in the YouTube channel description of this video brief. We'd like to acknowledge support from the National Institute of Disability, Independent Living, and Rehabilitation Research, and the Center for Mental Health Services of the Substance Abuse and Mental Health Services Administration.